Hello everyone, I am Dr. Mahesh Reddy, Consultant Interventional Radiologist, Star Hospitals Financial District. Today we will discuss about brain stroke. So what is brain stroke? What are the types of brain stroke? It is ischemic stroke and haemorrhagic stroke. What is meant by ischemic stroke? Ischemic stroke is nothing but due to the block in the artery, the blood flow to the tissues get affected and it will cause some symptoms. That is called ischemic stroke. Whereas hemorrhagic stroke is due to the rupture of the blood vessels, bleeding happens in the brain parenchyma or adjacent surface and it will cause some symptoms. That is called hemorrhagic stroke. So mainly we'll discuss about ischemic stroke today. So how the patient presents? Generally patients present with a neurodeficit, that means facial deviation or difficulty in speech or not able to speak, sometimes speaking irrelevantly, or one side of the body get paralyzed, that means weakness of the upper limbs and lower limbs on one side, and sometimes altered consciousness and altered sensorium, that means he is not able to identify the surroundings, not able to identify his relatives. So if these are the presenting symptoms, immediately we have to get the patient to the hospital, and after a routine checkup and routine imaging, a patient can be offered adequate treatment. Like if the patient comes within 4.5 hours, we can offer him IV injection, thrombolysis. If the patient comes after 4.5 hours, we have to image the patient, and if the certain criteria are met, then we can take him for mechanical thrombectomy. This mechanical thrombectomy can be offered up to 24 hours, but patient has to get to the hospital as early as possible so that we can save as much brain as possible. So time is brain. So if the time is delayed, the brain tissues are getting damaged. For every minute, around 10 millions of the neurons are getting damaged. So if these are the presenting symptoms, immediately he has to get to the hospital. So what is mechanical thrombectomy? It is nothing but a small incision is made in the groin region or a hand region, and then a tube is inserted, and we'll take angiogram and we'll see the blocked artery. There we'll put a stent retriever or a suction tube and we'll take that clot out so that blood flow is restored and that brain parenchyma is perfused well, so that his symptoms will be recovered. So what is the prognosis of the patient after the procedure? So if the patient has minor symptoms and if the patient is brought to the hospital very early with small damage to the brain, then he will have good prognosis. It depends on the prognosis, depends on the how much tissue of the brain is damaged when a patient is brought to the hospital. So if the patient is brought to the hospital early and the damage is very less, then he will have a good prognosis. So if you have these presenting symptoms, which is regarded as fast symptoms, that means F means face, facial symptoms, A means arm weakness, S means speech, any speech deficits, and T means time. If there is a time of onset, you have to bring the patient to the hospital with adequate stroke facilities. Well, all these facilities are available. So in Star Hospital, we offer good facilities for the stroke intervention for mechanical thrombectomy. We have good state-of-art cath lab with adequate facilities. Thank you.